Hello folks, how are you doing? Don Kelly here. Happy Wednesday to you all. Just finished a day's work in my Charleville clinic, so a good opportunity here to do a quick 3 or 4 minute live video talking about chronic pain. Okay, so if you just bear with me a couple of minutes, I can give you some advice on it. Now, chronic pain is generally it's considered pain in general that has been going on over 12 weeks. So if you're having pain that's been going on more than 12 weeks, it's generally classed as being a chronic pain. Now, in saying that, there's people who have had chronic pain for 12 months and 12 years also, if not longer. Now, I'm just here to let you know that in my personal belief, lots of people think that because they have chronic pain, people think they're stuck with it and it's the way it is. Usually they feel because if they're a bit older, 50 plus, whatever, 40 plus, 60 plus, and they start getting pains and aches and it becomes more persistent, they think it's just part of getting older and that they have to deal with it. In my opinion, it couldn't be further from the truth. Now, there are definitely conditions out there that, you know, do cause pain chronically, that need medical attention and may need surgery and so forth. But there's a lot of people out there with chronic pain that are just muscular in nature and can very much well be treated with great success without drugs or without medication. So some of the reasons for people who do have chronic pain going on for long periods of time are generally people who've had a lot of wear and tear on their body over the years. People in the building trade, plumbers, fitters, bricklayers, all that kind of work. A lot of spinal activity, muscular activity over the years. That can put a lot of stress and strain on muscles, ligaments and tendons in the spine and the back, and pain can become very persistent. But it can, in my opinion, be relieved, and it can be relieved naturally through a good physiotherapy program, physical therapy, acupuncture, dry needling, loads of different options out there that can help relieve pain from a builder's point of view, from somebody who has been doing a lot of manual labour over the years. Another reason for chronic back pain, or pain in general, but just say back, are women get it and they wonder why, and generally if they've been wearing or spent long periods of time wearing high-heel shoes, you know, shoes with 3-4 inches of a heel, generally even a 2-inch heel long period, but 2 to 3 inch heels, long periods of that creates a scoliosis, creates actually a lumbar lordosis, which is an increased curvature on the lumbar spine, and over a period of time you can get pain there as well. That can lead to chronic back pain. It also can lead to chronic foot pain, pains in the balls of the feet also. Okay, so that's another reason why a person could have chronic pain. Being overweight, carrying excess weight can cause chronic pain, not just in the back but all over. Put stress on the spine, which in turn puts stresses on the ligaments and tendons, and also stresses on the nerves which exit the spine. And it depends on where a lot of the stress is happening and where the nerve is being impinged, it can refer into a particular area around the body. So there are just a couple of reasons why one would have chronic back pain or long-term pain. And some people get diagnosed with arthritis, other people get diagnosed with fibromyalgia and other conditions like that, and are put on long courses of medication. So sometimes the medication works for people, but sometimes the medication doesn't work for people. But generally what happens, long-term use of these meds will create further problems down the line, especially if they're steroids or steroid in nature. And and some people strong anti-inflammatories like diphene, some people find those hard to take, they're tough on the stomach, etc. So from my point of view, just because you're a certain age and you have a lot of pain, don't take it for granted that you have to suffer with this pain. You certainly don't. A few tips to manage it is take up yoga, Pilates, get active, go for walks, watch your diet, lose weight, drink plenty fluids, plenty water, avoid ice cold water, and keep good mental health. Okay, meditation is very good, and all those keep stress out of your life. Avoid anything that's causing stress within your life. It certainly doesn't happen. It doesn't help, should I say. So avoid all stressors, no matter where it's coming from, or try deal with it, or plan with it, or look after it the best you can. Okay, so look guys, I hope that little bit of information helps. Just remember, it can be dealt with, it can be managed without drugs, without medication. But just remember, if you're just after starting to get chronic pain, or if you haven't seen your medical expert, your GP, your doctor, and you're starting to get pain that's more persistent, look, I advise you to get it checked out medically first. Always go and see your health professional, just to make sure that there's nothing underlying going on. The chances are there isn't. 95% of all these problems are usually muscular, soft tissue in nature, and stresses put on the spine from different factors, many different reasons. Okay guys, thanks for tuning in. Any queries, please leave a comment, text me a message, send me a message. I will be more than happy to get back to you and answer any questions you have. Have a great Wednesday. I'll leave you, and I'll make a post again in a couple of more days with some more info. Okay, have a great day. God bless. Bye bye.